We are live, sir.
Thank you. Good evening, everybody. I'm Dr. Nilesh Balkawade, Clinical Head and Fertility Specialist at Oasis Fertility, Pune, at Wakad and Kharadi branches. Today, we are going to talk about fibroids and infertility. Fibroids have been an enigmatic problem in females, especially during their reproductive lifespan. The occurrence of fibroid can be as early as the post the menarcheal group, and it can extend till up to the menopause. However, we are concerned today about those who are in their active phase of reproduction, especially in their 20s or early 30s. The incidence of fibroid will go on increasing once the age increases. So, especially those women who are having a long-standing infertility and whose age is more than 30, the problems of fibroids can be more so increased. What are these fibroids? So fibroids are basically benign tumors which are usually non-cancerous. They are made up of smooth muscle cells arising of the from the uterus, which are usually the smooth muscle cells, and fibrous connective tissue. They develop in the uterus, and it is estimated to be 70 to 80% of women will have fibroids sometime in their lifespan. That's the very high incidence, especially in cases of infertility. Not everyone who has fibroids will have symptoms. So not every fibroid needs to be removed or needs to be got a treatment. Only those women who have symptoms or who have problems due to fibroids need any sort of treatment. Fibroids, as we can see in the picture, can arise from within the cavity, it can arise from outside the cavity, or it can be present in the uterine wall. The fibroids which are present inside the uterine cavity are called as submucous fibroids, or the fibroids which are present in the uterine wall but they are extending into the cavity. So these are usually called as intramural fibroids which have a submucosal component. These fibroids, which are indenting into the cavity or which are present inside the cavity, are the most important ones to be managed before the patient takes any sort of treatment for infertility. Fibroids, which are intramural and which are away from the endometrium, may or may not need treatment depending upon their size, depending upon the symptoms which they produce, depending upon any rapid growth in their size, and so on. Fibroids which are outside the uterus towards the serosal surface are called as subserous fibroids. Subserous fibroids tend to grow larger in size because they usually are associated with less symptoms. Once they grow larger enough, they can cause pressure symptoms, they can cause dull aching pain, and so on. Now, let us see some facts about fibroids. Uterine fibroids are the most common tumors of female genital tract, but they are non-cancerous. Secondly, women who are nearing menopause are at greatest risk of fibroids. So those who are approaching their 40s, those who are near their 40s have a high incidence of fibroids, especially those patients who have infertility after the age of 35, they can have fibroids as a diagnosis which can be routinely there. Fibroids are most often found during a routine pelvic examination or an ultrasound, which has become an easy option to diagnose fibroids. Symptoms may include heavy and prolonged periods, bleeding in between periods, and pelvic pain. So, these are certain facts about fibroid. The international body called as International Society Federation of Gynecology and Obstetricians, the FIGO, has classified these fibroids into types 0 to 8. The types 0, 1, and 2 are usually the intracavitary fibroids or called as submucosal fibroids. Type 3 to type 8 usually are the intramural going up to the serosa and the outer surface of uterus. There can be hybrid leiomyomas, which are comprised of both involvement of the endometrium as well as the involvement of serosa. Now, the submucous fibroids are 0 to 2. The intramural fibroids are usually 3 and 4. The subserosal are usually 5 to 8. 8 is usually classified as others, which includes the cervical fibroid or parasitic fibroids. Friends, now let us discuss the symptoms of fibroids. What problems can fibroids cause? They can cause painful periods or dysmenorrhea. They can cause heavy bleeding during periods, especially when they are near to the uterine cavity or endometrium. They can cause enlargement of a lower abdomen and cause a mass feeling in the lower abdomen. Sometimes they can cause painful sexual intercourse, that is called as dyspareunia. They can cause infertility in a good number of patients. And if these fibroids are present during pregnancy, they can cause certain pregnancy complications, which are definitely increased due to the presence of fibroids. Today, as we told that we are going to discuss about fibroids and infertility, let us see how does fibroids impact fertility. So, what are these mechanisms by which fibroids affect the reproductive function? Fibroids can affect the fertilization process. It can cause the anatomic distortion of the cervix. Therefore, the sperm migration towards the egg can be a problem. It can cause altered uterine contractility. Now, this uterine contractility is very much essential for traveling of the gametes to their respective places, and also the travel of the embryo from the fallopian tubes towards the uterine cavity. And if there are abnormal altered uterine contractility, this can be hampered. Deformity of the endometrial cavity again is an important aspect of having problems with fertility. Some fibroids can obstruct the tubal ostia and therefore, in turn, can obstruct the entry of sperms into the fallopian tube, and this can cause problems for fertility. What are the impact on implantation? So, this was regarding fertilization. So, fertilization can be defective because any of these factors. Effect on implantation, the fibroids can cause altered endometrial development, and therefore there can be difficulty in the fibroids to attach to the endometrial lining. The fibroids can prevent efflux of discharge or blood, and this can cause problems. Distortion of the shape of endometrium can also again a problem because of fibroids. Fibroids which are near to the endometrium can cause altered endometrial receptivity, and therefore the implantation can be a problem. Now let us see how can we diagnose fibroids. Fibroids are usually diagnosed by clinical examination. On history taking, we can have symptoms which are related to fibroids. And on the clinical examination, especially the abdominal and the uh, bimanual examination or the gynecological examination will reveal the presence of fibroids. By routine clinical examination, we may not be able to diagnose submucous fibroids, but intramural large fibroids and subserous fibroids can easily be diagnosed by routine bimanual clinical examination. Important tool in diagnosis of fibroids, which is now helped us to increase the diagnosis. Also, the incidence of fibroids are increased because of it is ultrasound. Ultrasonography can be done by either abdominal route or a transvaginal route. The transvaginal ultrasonography is a very important route as it uses high frequency vaginal transducer of 8 to 10 megahertz, and this will detect even the smaller fibroids to a greater extent. It will tell us the relation of fibroids with the endometrial cavity. It will also guide us regarding the relation with the serosa. And if we are planning any surgery, it will help us to plan that surgery. This is called as fibroid mapping. And this mapping of fibroids is very much essential before we go venture into any surgical procedure for the patient. Ultrasonography can also detect the blood flow of the fibroids by using a Doppler. Also, we need to differentiate fibroids from certain other lesions like ovarian masses, adenomyosis, and so on. If there is any confusion in diagnosis, or if we want to diagnose any other lesions associated with fibroids, or if the fibroid size is very large or they are rapidly increasing fibroids and we are suspecting malignancy, In all this category of patients, the next investigation can be done, which is a MRI or magnetic resonance imaging. MRI will help us to differentiate this highly growing or rapidly growing lesions, or if there is any problem with the diagnosis. After MRI, we can use certain procedures which will help us to not only to diagnose the fibroids, but also treat them in the same setting. This is called as see and treat principle, and this is valid for tests such as hysteroscopy, where we can remove the submucous fibroids, or laparoscopy, where we can remove the intramural and subserous fibroids, also the adnexal fibroids or parasitic fibroids. Now we come to the treatment of fibroids. Treatment of fibroids can be divided into uh, three categories: conservative, minimally invasive, or surgical treatments. If we go for conservative management of fibroids, there are certain medications which can be used to decrease the size of fibroids. These are not as effective as thought, but they can be used to buy time if the patient has got anemia associated with blood loss, or if any other symptom because of which the patient may not be able to operate during that time. Also, in cases of small fibroids, we can use medical line of therapy. In medical line of therapy, there are certain tablets which can be used or certain injections to downregulate the pituitary and to decrease the size of fibroids. So these are called as GnRH agonists, and we can use this for shrinkage of size of the fibroids. Also, if there's associated adenomyosis and endometriosis, we can use these medicines. Next level of treatment is minimally invasive or non-invasive. These treatments include insertion of the devices into the uterus called as intrauterine progesterone device, or commonly called as Mirena, which can be inserted into the uterine cavity. This will release a hormone in a small portion daily on a daily basis, and we can decrease the size of fibroids. Along with this, there are certain non invasive or minimally invasive techniques such as the magnetic resonance guided focused ultrasound surgery or MRGFUS, where we can reduce the size of fibroids by MR guided ultrasound energy, where we can map that fibroid, and this ultrasound energy is guided towards that fibroid, and these fibroids are shrink with this help of this energy, and this fibroid will totally go off in one or two settings of MRG FUS or magnetic resonance guided focused ultrasound surgery. Another non-invasive method is uterine artery embolization, but this cannot be practiced for those patients who are desirous of future fertility, those who want their infertility problems to be treated. So this cannot be used. However, MRG, FUS, or magnetic resonance guided focused ultrasound surgery can even be used for those patients with who are taking treatment for infertility. After this, we come to the surgical management of fibroids. Now, this will depend on whether the fibroids are present inside the cavity. So we can do a hysteroscopic myomectomy or hysteroscopic morcellation of these fibroids. Grade 0 to grade 2 fibroids can be removed by hysteroscopy. However, it's technically difficult to remove grade 2 fibroids in some cases. In those fibroids which are intramural or large subserous fibroid which are hampering the fertility, we can remove them by using a laparoscopic myomectomy. For laparoscopic myomectomy, we can use certain specialized medications to decrease the blood loss during myomectomy. And the recently used equipments are very, very important. They help us doing the myomectomy in a very professional way and with very less blood loss. So we can remove these fibroids. Once we have removed the fibroid, the uterus has got some sutures are placed over the uterus from the area where we are removing the fibroid, and this healing process will take some time. So a pregnancy should not be advised at least 2 months after the myomectomy surgery, and later on the pregnancy can be advised as early as possible, because once there are fibroids because of any hormonal imbalance, there is chances of any repeat fibroids later on. But if the patient goes for pregnancy, usually the chances of recurrence are less. Let's see what are the problems of fibroids with pregnancy. So, per se, the myomectomy procedure will have a scar in the uterus, and there will be small defect, which will be there in the uterus throughout, and this can predispose the uterus to a spontaneous rupture or rupture during labor in patients of myomectomy. So, these patients have to undergo elective cesarean section during their pregnancies. Also, if the fibroids are present during pregnancy, there can be certain challenges. There can be repeated pregnancy losses if the fibroid is within the cavity. There can be increased risk of miscarriage. There can be something called as red degeneration, which is a painful change in the fibroid where we can have uh, thrombosis of the vessels, and this will cause extreme pain in the fibroid, which has to be managed conservatively. Sudden increase in size can also cause problems. Then, during the third trimester, there can be a malposition of the fetal head because of presence of fibroid in the lower segment. There can be dysfunctional labor. The labor can be a problem, and the baby may not be able to come out if there is a fibroid in the lower segment. Problems during cesarean section also exist because if the fibroid is present in the lower segment, it's difficult to access the head of the baby or the fetal parts through the fibroid, and therefore we may have to remove the fibroid first and then approach the baby. So the cesarean section or operative delivery can also be challenging in some cases of fibroids. So, friends, overall, fibroids in the reproductive age group remain a challenging problem. And with infertility, there are certain fibroids which can cause infertility, and there are certain fibroids which we can diagnose by certain routine tests, and a few group of fibroids which we need removal before going for infertility treatment. May it be a natural try along with medications, IUI, or IVF. Suppose we are going for IVF and fibroid is coming in the way of your transfer or it's near to the endometrium, we need to remove that before we transfer the embryo to make the environment in the uterus less hostile for the growing embryo. So, thank you for your patient hearing. That's about fibroids in infertility. Any questions, we can take it over. Yeah, thank you. What are the symptoms of myoma? Myoma or fibroids usually are small masses or tumors inside the uterus, and if they are present within the uterine cavity, they can cause menorrhagia or increased bleeding during menses. They can pose problems with fertility and cause infertility issues. Then, if the fibroids are present inside the uterine wall, they can cause increased menstrual blood loss, they can cause dysmenorrhea or painful menstruation. If the fibroids are large enough and they are grown to a huge size, they can cause pressure symptoms, especially on the urinary bladder or on the rectum, and there can be problem with urination or defecation. So the fibroids can also press on lateral organs such as the ureters, and there can be decreased flow of urine outside, and this can predispose to urinary tract infections. So all these are symptoms. Along with this, fibroids can cause infertility, which is a very, very important symptom of the problems of fibroid. Next question is, can one get pregnant with myoma? Yes, definitely they can get pregnant with myoma. Only thing is we have to assess where the presence of myoma is and accordingly plan treatment for such patient. If the myoma needs removal, we can remove it by hysteroscopy or by laparoscopy, which is a minimally invasive technique. If the myoma does not need to be removed, it can be down-regulated, the size can be reduced before we go for further treatment by use of GnRH analogs or certain other medications for fibroid size reduction. What is the main cause of myoma? Myoma are usually tumors which arise from the smooth muscle cell of the uterus, And there's no specific cause, but it is said that hyperestrogenic status or unopposed estrogenic action on the uterus can predispose to the formation of myomas, especially late marriages, late childbearing can predispose to the presence of fibroids. Sometimes there can be um, small fibroids present initially, but hyperestrogenic status can predispose to the occurrence of large fibroids. So, especially these are the causes of fibroids. What is the difference between cyst and myoma? Cysts are usually fluid filled collections, and myoma is a solid tumor. Cysts are usually seen in the ovary or near the ovary, that is para ovarian region, or they can also be seen in the myometrium, that is the uterine wall, but they are very, very rare. The myometrial cysts are quite rare. So cysts usually are present in the ovary, and sometimes small cysts can be conservatively managed and totally they go off with certain medications, hormonal medications. Some cysts also need removal by surgery or aspiration by a needle. So all these are the differences between a cyst and a fibroid. How do I know if I have a myoma? So, as I told you, that if the patient has some symptoms like dysmenorrhea, heavy bleeding, pressure symptoms, infertility, they can consult their doctor. The doctor has to do a clinical examination and certain diagnostic tests to diagnose whether you have a myoma. If the myomas are large enough, they can be diagnosed by clinical examination. If they aren't large enough, we can diagnose them by doing certain tests such as ultrasonography, MRI, or hysterolaparoscopy, and then we can diagnose them. Yeah. So thank you for your questions. At Oasis Fertility, we are more than happy to answer all your fertility related queries and any issues of your uh, related to gynecology, such as fibroids. Fibroids especially can cause problems with infertility as well, and that's why it was very prudent in considering this topic to be discussed. If you have any queries related to fibroids, or if you have any queries related to infertility, you can dial our helpline number, which is given below, or you can visit any of our centers in Pune. These centers are at Dynasty Commercial, Wakad, and Arisa Avenue near World Trade Center, Kharadi. So it will be our great pleasure to serve you and have your problems been answered. If you like this video, kindly subscribe it, like it, and share it with the near ones who need this information. Till then, I come with the next topic next week. I'll be happy to see you and to have your feedback being written here. Thank you so much. Thank you.